All right, everyone. Thanks for joining us on the news briefing for this Wednesday. Just a reminder, if you are not speaking, please put your microphone on mute. We sure appreciate it. So, of course, we're going to start our briefing with the latest on the Rocky Creek Bridge slip out. There are a lot of agencies and organizations working on this. We'd like to start with our colleagues at CalTrans, Kevin Drabinski. I'm hoping you and Zeke Dellamas will give us the latest on that. Kevin, did I lose you? Zeke, I see you're on the call. Anything you can share with us? Hey, Nick, are you hearing them? Or is
I'm
it just
hearing
me?
you okay. If
But
you all can,
I'm not hearing Nick.
yeah,
I'm sorry, I'm not hearing Kevin.
I'm not hearing him either. If you all can hear us, please give us a thumbs up. We want to make sure there's no technical issues. Okay, thank you, Kurt. Thank you very much.
Kelly,
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 you might be able to step in here. I don't know what the technical problems are.
Apparently Zeke is muted. I can help out, but it looks like he is muted. Can somebody unmute him?
He's not showing muted on our end.
Okay.
he's not muted.
Okay, and I would expect Kevin to get on too. Let me see. I'm getting a text message from Kevin. Just a sec. He lost internet connection. He does not have Zoom. Where to start? Are you looking for an update for today where we are at?
Yes, and would you like to take a minute? I think we've got Jessica Madueno from CHP on, and she might be able to step in here. And then if you want to kind of regroup.
Yes, I
Maya,
will get.
it looks like Zeke is that telephone number 8258. That's what he said in the chat.
Yeah.
So Zeke,
I will get Kevin and or Jim back on. So stay tuned for just a moment, okay? We can proceed with someone else.
So you can unmute yourself, Zeke. I can't, it's not letting me unmute you.
All right. Why don't we move to Jessica from CHP?
Yeah, Jessica, are you able, sorry, we're going to take you out of order. Can you step in here?
Yes, of course.
Thank you. And give us the latest on the convoy and the situation with CHP.
Yes, so the latest here in the area, thank you everybody for having the California Highway Patrol be a part of this conference here. So this morning specifically, I'll talk with the first convoy that took place went well. We had a total of 315 vehicles that traveled through the convoy. We had approximately 165 travel northbound, along with 150 that traveled southbound. And so far, so good with all the convoys. I understand that there will not be convoys the next 2 days due to the weather, but they are expected to resume on Saturday morning.
So if you could give us the advice that you would tell to those who are in this area in terms of taking advantage of these convoys today.
Yes, so please keep in mind there will be one more convoy at 4 p.m. this afternoon before the 2 days that we will not have these convoys. Remember, these are just for residents of the area, and we do want to remind folks that if you're traveling through there and you work in that area, to keep that in mind the next 2 days that we will not have these convoys. Those that are in the area, please remember to be patient as you're deciding maybe to make a U-turn in these lines. Remember to keep in mind of the traffic that's around you and those that can be on the shoulder.
Thank you so much, Jessica. And then a reminder, if you're not speaking, please go ahead and mute yourself. And are we able to get CalTrans on?
Hi, Maya. Yeah, Maya, this is Zeke. Oh, go ahead, Kevin. Take it away.
Hey, there you are, Kevin. Thank you.
Thank you. What a time for my internet to go out. CalTrans just wants to reiterate and reduce any element of surprise for the community that we will be suspending convoys Thursday and Friday due to rain. This is a recent slip out. We've had eyes on it continuously. It looks as if it has not advanced anymore from its original state, which is a good sign. But because it's such a new event and because it's such a new location, and because it was likely caused from saturated ground in recent rain events, we're going to suspend any travel across the closure area for Thursday and Friday. So no convoys happening Thursday and Friday. We expect that the convoys will resume Saturday at 8 a.m. That's our intent. That's our hope. Should we examine the site and there be any concerns, we'll of course broadcast that to the community. However, at this time we're looking for a Saturday reopening of the roadway. This week we were able to take advantage of the time between the convoys to increase a little bit of the margin, a little bit of the width of the northbound lane. We refortified a drainage ditch there with some gravel and fabric, so that will continue to function. But we were able to pave a little bit more, if you're going northbound, a little bit more on the shoulder side to give a little bit of extra width to that lane. We're just able to capture as much space as we can for vehicles to travel. And then once the rain subside, for the crews to be able to return there and get back to work to give them a little bit of space as well. I have a report from this morning's convoy that we had 250 travelers in the northbound direction at 8 o'clock and 285 in the southbound direction as well. That's all I have for the Rocky Creek report. If I can just have 30 seconds to say that there will be a full closure of Highway 1 in Capitola, 24-hour closure, which starts at 7 p.m. on Saturday and goes till 7 p.m. on Sunday. And that's for the demolition of the Capitola Avenue overcrossing. And so we advise members of the Monterey County community, if you need to reach Santa Cruz or up the coast in the Half Moon Bay area, that US 101 remains a viable alternative. And that's the end of my report.
And we're happy to have you slip in some additional safety road information for those of us who are traveling. Thank you so much, Kevin. And Zeke, I don't know if Zeke wants to add in anything here.
Maya, thanks. Sorry again for the communication issues. We do this regularly, and of course, at a press briefing is when we would have something where we have some challenges here. But no, I really don't have anything to add to what Kevin has addressed. Again, though, I'd like to stress that this is a new situation that just came up on Saturday, and our crews are actively engaged. We're moving in. We were fortunately able to complete those assessments as soon as possible early that morning, and we're able to provide the limited access that we did. So when you look at the photos and you recognize the significance of this slip out, I think it has to be noted that we're really doing everything we can to provide the limited access that we're comfortable with, but it's really a situation where we're managing the risk, and it's so fresh that it's going to just take us a little bit of time. We will be engaging in a multi-phased approach to stabilization and ultimately, unrestricted future access here, and simultaneously developing project which will fully restore the highway, likely a structural solution. And our teams are fully engaged on both paths to the temporary stabilization, in situ stabilization effort, as well as a longer term goal. So at this point, I have nothing other than that to add, except, I'd like to stress that, we're cognizant of how much impact this has on the local community, the business community, and, potentially emergency response here. And we're moving forward as quickly as we can with that. That's all I have now, but if there are questions later, between Kevin and I and others on the call, we'd be happy to try to address those. Thanks.
Thank you. And then we did have a question. Well, we've got Jessica here. We don't want to let her go without getting a question to her. As far as people coming and going through the roadblock, through the slip out roadblocks, are you requesting identification for residents?
That's something that I'll have to confirm, Maya, because remember that the officers they're at the fixed post up at the very top of the closure. But depending on how far back the officer can get without having vehicles travel through that closure, we want to make sure that we maintain that, depending on the line of vehicles. But that's something that I can get information to you later.
Thank you. I appreciate it. And we did have a question about the convoy numbers, and because Jessica, you gave some information, then CalTrans gave some information. Are these kind of head counts in being done by different people?
These are just approximations.
Okay. And so it sounds like, Kevin, what are you thinking on these numbers? And Jessica, what would be a good number for our colleagues in the press to go with?
I had a report from the field northbound this morning, 8 a.m., 250 northbound, 285 southbound. Again, that's our best estimate from this morning from the field.
And Jessica, your numbers were slightly different. How do you feel about that?
Those are from the officers in the field, but we can go ahead and use Kevin numbers, so we go ahead and stick to something consistently.
So we're going to go with, at this, again, knowing that all things are approximate, 250 northbound and 285 southbound. Okay, we'll go ahead and thank you both for letting us work this out on the fly. We've got Commander Joseph Banuelos from the Monterey County Sheriff's Office. We're really pleased to have him here. We're hoping he can give us some more additional information, particularly on the evacuation warning that went out this morning. Good morning, Commander.
Good morning. Yes, the warning went out this morning, and like it stated, it's just a warning, and I can't say anything more than that right now. The residents are probably going to stay. Whoever's going to leave, they're going to leave. And the hard closure, when it comes in later this afternoon, is what's going to be.
It sounds like he's in an area where there's some difficult cell reception as well. So, Commander, I'm hoping you might share with people here a little bit about the Big Sur community. And you know this community, not everybody leaves, but the warning itself is still very important.
Yes, it's very important. The residents of Big Sur are very resilient. This is something that's not uncommon if you live in the area. When we have our wet years, they basically know how it's going to occur with the weather. They pretty much plan ahead, and they do abide by those who need medical attention or medications and stuff like that. They do leave the area if needed, but for the most part, they all stay in shelter in place.
Could you also expand a little bit on, with this closure in place, that there is still emergency services that would be available should the need arise?
Yes, we are collaborating with CHP and Parks Department during this closure for the next 2 days, and if there's calls for service, they will be responding and taking care of the detail at hand. After that, when it opens up again, we will, once they allow emergency traffic across again, we will continue as needed. And I think CHP can probably speak on that as well.
Jessica, do you want to add to that? And then we'll get to Kevin.
Yes, I can go ahead and add to that. Yes, so we do have our 2 resident post officers that are down in Big Sur that will be attending to service calls. Absolutely.
And then Kevin, you wanted to add in?
If I could, hope everybody wrote the convoy numbers in pencil. The updated numbers that I received this morning, I was reading off of an old message. The numbers that I have for the 8 a.m. convoys on Wednesday this morning were 157 vehicles in the northbound and 165 in the southbound. And I hope that clarifies it.
That's great. Never too late to add that. We did have a question, and this this likely would be for Commander Banuelos. Given the evacuation warning is in and around the current closure, worst case scenario, if the warning becomes an order, can we get an idea how that process would work given the slip out situation? And perhaps that's notification would be a challenge.
You're stating if we lose the roadway month?
I think he was saying, should the warning turn into an order, how would that process work?
If it happens within the next 2 days, then it's going to be incumbent upon, I'm assuming the CHP and the parks, because we're not going to have anybody across there to actually go to physically to each home and contact them, but it'll be reverse 911 most likely. And you're talking about if it occurs today? Is that the question?
Well, if it occurs,
then there
could be different scenarios, different times.
If the scenario changes within the next, 12 hours, then we would probably send down our seat members and go down to contact residents, as many as we can during that time, reverse 911. And again, it's incumbent upon the residents. It's their option. We can't force them to leave, but we could encourage them to leave. We make sure that they have proper supplies to maintain themselves, and we track each person, each resident, with a website who we contacted, and if they've chosen to stay, we get their information.
Thank you. I know the question was kind of very broad, so I really appreciate it. I'd like to bring in Kurt Gafill, the president of Big Sur Chamber of Commerce, and also a business owner in Big Sur, to talk about the impacts that this is having on the community there. Hi, Kirk.
Thank you, Maya. Thanks for including us. First of all, a big thank you to CalTrans for the very expedient convoy organization and all the other agencies that supported that. That provided an enormous relief and immediate need to allow our visitors to leave who are otherwise trapped, and then provide for resupply and for stranded Big Sur residents to come back into Big Sur. So during the convoys, and if we're only looking at a 2-day suspension, basic residential life is it's inconvenient, but it's pretty manageable for most residents. Unfortunately, the convoys, while they provide access for essential employees and supplies, do not provide for economic relief to the businesses. So our focus at this point is that we have our probably 75 to 80% of our workforce is going to be on very reduced, if not eliminated, hours. And the economic damages are likely to be in excess of $1 million a day with each and every day that this closure continues. So we are appreciative of all the effort to get the road reopened in a timely manner, but it's just absolutely essential that that single lane be made open to the public at the earliest opportunity so the businesses can reopen and employees can be back at work. Thank you.
Thank you. And Kelly or Kevin, Kirk brought up the repair, and this is it's really way too early to talk about what a repair might take, but you might be able to talk about the length of time or the time that it would take to make the plan to do this, to give people an idea of what that is involved with that.
Kevin, would you like me to respond?
Thank you, Kelly.
Yeah, so we are in the early days, right? We're making every effort to make the repairs as quickly as we can. Our goal right now is to talk to specialized contractors that will be working on that edge stabilization effort first. That's the first step. So we hope to have a draft schedule out at some point on Friday. This is really a multi-step process. We have the edge stabilization, and then the long-term repairs will be some sort of structural solution, likely, but undetermined at this time, similar to what was done just south of this location. That is a longer-term process, but when that occurs, we are hoping to have a temporary signal in there that would allow for traffic to proceed, without limitations. Does that answer your question?
Well, it's a good opportunity to talk about this because everyone is very anxious, not only the folks in Big Sur, but all the visitors are, and giving them just a sense of understanding about what it takes to put this together, gives everyone a reality check on, how to make plans and how to deal with it, with what's at hand. Are there any questions for Kirk or any of our participants? I do have a question in chat, and well, let's see who can answer this one. Can someone clarify what emergency services will be available when the Rocky Creek slip out area is closed? It's a multi-part question. Let's start with that. Nick, you have a question? Your hand is up.
Yeah, no, I wanted to also make note, Maya, that we are providing on a daily basis updates to the Big Sur community on information that we get. And so I think that's important to note. And also that we do have CERT teams, which is community emergency response teams in the Big Sur area that are volunteers for the county and trained by county personnel and the sheriff's office to help the residents in that area. So I just wanted to make that note.
Thank you. That's a good point. And that actually dovetails also on what Commander Banuelos said. And Commander, I see you're still on the call. Could you refresh that information that you shared about who would be in the closure area? And Jessica from CHP, I think you mentioned you had people there as well.
Yes, for the Sheriff's Office, we are not going to have any personnel down there. Like I stated, we are collaborating with CHP and County Parks to handle calls for service, both criminal and vehicle code violations. If the need be, if we need to, during the next 2 days, something happens, we will end up either have to get in a helo or some other way to get in there. But we did stage a vehicle down on the other side just in case, but we're hoping nothing happens in the next 2 days. And then we will proceed we will be allowed again for emergency response or first responders to go across. I think Jessica could probably elaborate.
Yes, please. Thank you. I appreciate you filling us in on that.
Hello again. Yes, so we will have resources there and for calls of service, but of course for assistance to our allied agencies. Within those 2 days, we'll have our resident post officers that reside in that area.
So in this question, which is multi-part, it also goes on to ask, the initial evacuation warning from the Sheriff's Office said emergency medical services may be unable to evacuate patients beyond the road closures. But Jessica, as you mentioned, you may have people there who could assist if a crisis did occur.
And that is correct. If need be, we will be there.
Thank you. And I hope that answers, I think we answered it as best we could. Another question, and this may be for CalTrans, is there more inspection done further up and down the lane away from the slip out being done to evaluate the ground on the edge of the highway? And then the second part of this is, are there any overall long-term plans to somehow reinforce or stabilize the edges of the highway moving forward? And Kelly, you may have addressed some of this already.
Yeah, and I will let Zeke talk as well, but we respond to events as they happen. So we're not necessarily going out and looking to fortify the entire stretch of the Big Sur coast, right? But we do have eyes on it all the time with our maintenance crews and are on watch for looking for areas of distress. Does that help?
I think that's a little bit of of that question. And Kirk, you had your hand up. Please chime in.
Thank you. Just going back to the emergency response question, additional resources in Big Sur in the closure area are Big Sur Fire volunteers, as well as CERT, as Nick mentioned. And AMR has had its ambulance and its ambulance crew, which is a paramedic and EMT, at least through this morning. I'm not sure if they're still in the area or if they left, but for the last several days, we have had a advanced life support ambulance here in Big Sur.
Thank you. I don't, let's see if anyone can answer this one. Can someone speak to the upcoming weather for the next 2 days that have prompted the pause in the convoys, and if that could pose a threat to other portions of the road? And Kelly, you talked about taking each incident as it occurs, I think. So maybe you could respond to this one.
Sure. Let me see. So, let me see that have prompted the pause on the and how it could pose a threat to other portions of the road. It's the same thing. You know, we do winter prep all the time. Every year we get out there, we make sure our culverts are cleaned out. We make sure that we are aware of problem areas and addressing those concerns. It is a dynamic environment on the edge of a continent, and you know, we can't anticipate all failures, but we do winter preparation efforts to you know, try to protect against these kind of events as much as we possibly can.
Thank you. I appreciate you chiming in on that. People may not realize it's a, you know, this is work that goes on year round for a road like Highway 1. Are there any other questions for the folks related to Rocky Creek? And I'm not seeing any other hands up. And I'm not seeing anyone in any other questions in chat. Thank you all who came to talk about the Big Sur situation and giving everyone the status. We really appreciate the information. And we've got one more topic that we're going to cover, and I hope you all stay and listen because it's interesting too. It just doesn't have to do with the roadway. We appreciate you all.
Hey, Maya, one quick thing. People should sign up for the Alert Monterey County system. So if one of the biggest messages we need to get across to all residents in the county, especially down in Big Sur, is if they haven't signed up for Alert Monterey County, to do so by going to alertmontereycounty.org. It's very, very simple to get set up for the emergency alert system, which will text them, which will call them on their phone, and which will send email messages to them. So I wanted to get that plug in. Thanks very much, Maya.
Excellent, excellent plug, and thanks for doing that. So we do have one more topic here, and it is an important topic. It is about our public health. Public health is more than just healthcare. It is making sure neighborhoods and our environment are free from pollution and our food and water are safe to drink. We're very pleased to have our public health officer, Dr. Ed Moreno, here to talk about public health efforts on this week that celebrates Public Health Week. Hi, Dr. Moreno.
Hello, good afternoon. Hi, Ed Moreno, I'm Director of Public Health here in Monterey County. And yeah, it's a National Public Health Week, and National Public Week this time that we recognize the public health efforts to support our communities to achieve the best health possible. And we also recognize the great work that's being done by public health practitioners that do that great work. And for more information, people can go to about National Public Health Week, they can go to nphw.org. That's nphw.org. This afternoon, I just want to focus on some of the local work that's being done through public health, and to help organize the presentation. I'm going to actually present about 11 groups of services. I think that might help to describe the array of services that we provide to the community. So one group is one thing that we do is we improve the nutrition for low-income families. We do that through our public health WIC clinics. They're located in different cities here in Monterey County. Stands for Women, Infants, and Children. That's a nutrition program. We also, as part of that, we have a CalFresh Healthy Living program where we provide nutrition classes and services and education to folks and families throughout the county. And we actually have nutritionists, writing nutritionists, who provide our consultants for those services. Another thing that we do is we prevent injury, chronic disease, and prevent premature death here in Monterey County. And just provide a few examples, we have a car seat program for babies, parents of babies. We have a child helmet safety program to help parents get helmets for their kids who ride bicycles. We have a robust active transportation program that works with a variety of agencies in Monterey County to make it easier and safer for kids and families to commute in ways other than in cars. We also have a tobacco control program that tries to educate the community about the dangers of using tobacco products. And we also have a oral health program that works to increase the rate of the number of kids who, young kids who have dental exams to try to promote good oral health. The other ways that we prevent injury and chronic disease is that we have a cannabis program within public health. We recognize that cannabis is legal in California. We're not telling people that they can't use cannabis products. We don't. That's not what we do. What we do is we educate the community to let those folks that are at risk of adverse effects of cannabis use, primarily pregnant women and children, know that there are dangers to using cannabis when you're at a young age or if you're pregnant. And also we have a child lead poisoning program where we work with families and doctors in the community to try to reduce lead exposure, particularly to young children. Another area in public health that we're proud of is that we work with others to prevent teen violence and prevent teenage pregnancies. We have a CDC-sponsored Preventing Violence Affecting Young Lives program. We work with the schools there. We also have a Cal Personal Responsibility Education program, again, working with schools. And we have this particularly a postponed program where we recruit and train students to be peer mentors to work within the high schools to educate one another on how to prevent have health relationships, prevent relationship violence, and particularly pregnancy. A fourth area is that public health issues vital records. We issue birth certificates and death certificates, and we issue the permits for burials. A fifth area that I want to share is that we improve the health of mothers, babies, and children in Monterey County. We have a maternal child adolescent health program and a nurse family partnership program. In both those programs, we provide, we enroll women and their babies into our program and provide case management where we work with them to help them understand the benefits of healthy choices during their pregnancy and after pregnancy to optimize their own health, reduce complications of pregnancy and delivery, and have healthier babies. And we also work with to investigate any sudden infant death syndrome events that might occur to try to reduce those events in Monterey County. A sixth area I want to share is that we in public health improve access to pediatric health care. Public health does not provide health care, but we can improve access to health care. And on the pediatric side of things, we have the California Children's Services. That's a program where we case manage children who have who typically have complicated health conditions, and to make sure that they receive the specialty care that they need to optimize their lives. And some of those kids need physical therapy and occupational therapy. So we have therapy units different places throughout the county where we take kids in and we provide ongoing occupational therapy and physical therapy for certain kids. And also, there are also kids, especially groups, for example, kids in foster care. They need healthcare too. And so we have public health nurses that, again, don't provide healthcare, but we follow the kids and the families who take the kids and make sure that they're getting the care that they need wherever they are being placed. A seventh area I want to share is that public health improves the health of low-income, high-risk adults. We have another case management program, home visitation program, as it's often referred to, that we call CalAIM. And we work with individuals that may be homeless or have multiple health conditions and work with them and their healthcare providers and their specialty care providers to make sure that they know how to access housing and food and other services to make sure that they can take care of themselves so they can do a better job of taking care of their health conditions. We have a relatively new program. Also, it's a healthy aging program where we take a upstream public health approach to helping individuals, older adults, and those that care for them to understand whether what's the course of events as someone gets older, in particular their cognitive abilities, how to protect their cognitive abilities, and recognize early signs of declining cognitive ability and what they can do to help themselves and help those that help people who care for older adults. And we also have We aid victims of sexual assault. We have a sexual assault response team and a group that specializes in child assault. And we respond to requests from hospitals, emergency departments, and police departments to come and interview victims and provide any examinations they may need that can provide information for law enforcement and the healthcare providers and the victims and their families to take action subsequent to any potential or actual assaults. An eighth area in public health is that we prepare for and respond to emergencies and disasters. The most recent disaster was our pandemic, and we've been planning for that for years and responded to that. Prior to that, it was H1N1 pandemic, and we responded to that as well. But we also have specifically public health emergency preparedness and hospital preparedness, where we work with hospitals and skilled nursing facilities to make sure that they have plans in place, that they're up to date, and that they have the resources they need to implement those plans during the next disaster. A few more areas. The next is that public health prevents and controls infectious diseases. We have an epidemiology and surveillance group. They collect data on a daily basis from our local hospitals and healthcare providers about diseases and syndromes that are occurring in Monterey County. And should we get a report of a certain type of communicable disease, we have communicable disease investigators who will interview providers and patients and families to try to figure out what that illness is and how it might spread and how action to take to prevent further spread. Some of our infectious disease control are specific. We have a specific tuberculosis control program. Tuberculosis can be deadly, and we have a lot of one-on-one work with individuals who have tuberculosis and their families to treat them so they don't die of tuberculosis, and how to prevent it spreading further. And we also have HIV and sexually transmitted disease prevention programs to get people screened, identified, and into healthcare. We still work in the community to provide syringe and needle access through syringe exchange to reduce the spread of hepatitis C and HIV. Furthermore, we have an ongoing immunization program that was present before COVID, during COVID, and after COVID to make sure that we're promoting vaccines to prevent diseases like measles countywide. And a couple more areas I would just want to highlight. One is that we, in public health, test water for contamination. And we also test specimens that come from hospitals and healthcare providers for infectious diseases. We do that through our chemistry laboratory and our public health laboratory. And that's the laboratory that was one of the first in California and the nation to be able to test for COVID-19 when in the early stages of the pandemic. And finally, I just want to share that public health works to not only improve the health of people who are living in Monterey County or visiting Monterey County, but public health also improves the health of our own county employees. We do that with the county employee wellness program, which we administer. Some of the things that we do is we help the departments work with their employees who choose to breastfeed and make sure they can continue to breastfeed successfully while continuing to work for the county of Monterey. We also work with departments to make sure that they take advantage of opportunities to make sure that any snacks or beverages that are made available to county employees are the healthiest possible. We also oversee a fitness center, like a gym, specifically for county employees. And that is something that we work closely with the board of supervisors, looking for funding to make sure that that can continue to operate and be accessible to improve the health of our employees and reduce healthcare costs and reduce absenteeism with the use of that facility. Our program of wellness provides live and on-demand meditation, wellness, mental health, and nutrition and fitness exercises for all county employees. We also provide a variety of employee vaccination clinics, so our employees don't have to go to a pharmacy or see their doctor. They can schedule one of the clinics during working hours at various locations to get the vaccinations they need to stay healthy. And we make sure that we get the word out that the county does give every employee 12 hours of paid time to participate in these wellness hours. So overall, a great program for county employees. So that's it. Just wanted to take the opportunity and thank you for the opportunity to share some of the great work that and services that we provide to county residents and to our county employees. And again, if anyone wants more information on National Public Health Week, I'd encourage them to go to nphw.org. Thanks.
Thank you, Dr. Moreno, really for a great and thorough I think people don't know how broad-ranging and wide-ranging public health is. I know you're out of the county right now. Do you have a minute for a question or two?
Actually, I got to get back to what I'm doing right now. So, but thank you for the opportunity, Matt.
And so we're going to forward, for the person who asked Dr. Moreno's question, we're going to forward that question by email and try to get a response back to you.
And if anybody has any questions about anything that I covered or about National Public Week, I recommend that they get a hold of our Public Information Officer, Karen Smith. Most people in the media know Karen, so Karen Smith's always willing to take questions and try to get answers for the media.
Thank you, and sorry we had to keep you so long. Thanks everyone for joining us on the news briefing this week. Our next briefing is next week, and we'll see you then.